Welcome to our 10th and final Thrive with Axe Rehab Seminar. While COVID-19 changed our plans for how we provided these seminars and practically everything else, we were still able to get the information out to you in just some different ways. Learning how to thrive is more important than ever, as many of us experienced declines as a result of the pandemic. We saw an increase in falls, isolation, depression, pain, and an increase in problems related to memory and brain function. Many of these effects were a direct result of residents not getting enough valuable body and brain activity. Let's start by reviewing. Thrive stands for Therapy Helping Residents with Independence and Vitality Effectively. Experts in healthy living say that all older adults should be engaged in 5 types of exercise. They are strength, balance, flexibility, mind, and energy. All year we have talked about the importance of these various forms of exercise. So far, we've learned about strength, balance, flexibility, and mind. Today, we are going to finish with the last form of exercise. We call it energy. While it seems that all the focus in 2020 was on COVID-19, we actually learned about many other things throughout the year. But we are humans and we quickly forget. So let's take a look back at the year in review. In January, February, and March, we learned about the many aspects of achieving good balance. In January, we learned that good balance to prevent falls does not just happen. And once you achieve it, you cannot keep it unless you continue to challenge your balance and practice balance exercises regularly. In February, we learned about the cutting-edge technology that Axe has invested in called BalanceWear. This is a vest that helps improve balance. Many Axe residents have already tried BalanceWear and found it to be helpful in improving their stability. In March, we learned that dizziness is not normal and rehab can treat it. We learned that some type of dizziness can be treated in just one session. In April, we talked about flexibility and treating osteoporosis. Much like your car, if your body is out of alignment, it won't drive as easily, will wear out faster, and may become unsafe. Good flexibility is important for achieving good posture, healthy bones, how we look, and how we feel. A lot of pain issues can be boiled down to having poor posture and the need to stretch. When we sit too much in poor posture, we can actually become chair-shaped in standing. Poor posture makes it difficult to stay balanced, walk, talk, swallow, and even breathe. As with balance and strength, flexibility exercises should be prescribed for your needs by an exercise professional. In May, we talked about strength and how the right strengthening exercises help with pain and arthritis, and we introduced you to the Axe Chronic Pain Management Program. Here are the May key takeaways. Strengthening exercises are important for many reasons. Strong muscles actually provide support to arthritic joints, which decrease pain. Strong muscles improve our mobility and help us combat the muscle and bone losses that occur with aging. But it has to be the right exercise to target the right muscles with the correct amount of weight in order to be effective. This is why we recommend that an Axe therapist help you develop your strength prescription so you get the fastest results without complications. We also want to remind you about the Axe Chronic Pain Management Program. Nearly every Axe community ran at least one Axe Chronic Pain Management Program last year. This is an 8-week program that combines some physical or occupational therapy and a once-a-week group educational meeting with 2 to 3 other residents. Feedback from residents who participated last year said the program helped reduce their pain by over 50%. Contact your rehab department if you're interested in this program. The biggest takeaway from May is the extreme importance of leg strength. This is a quote from Dr. Mary Tinetti, who is a well-known physician and researcher. I'm going to read it to you slowly, word for word. Leg strength, not diagnosis, not cholesterol level, not age, not medication use, not any of the usual measurements, but leg strength was the single most powerful predictor as to whether a person was going to have to enter a nursing home. If you want to stay out of Willowbrook Court, make sure you work on your leg strength. How do you know if your legs are strong enough? Come to your annual Thrive screening, or accept the one-on-one Thrive screening being offered in every community, and we'll test it. A very quick test you can do at home is to sit in a kitchen or dining room chair, cross your arms, and stand up 5 times. You should be able to do this in less than 14 seconds without using your arms. We spent the summer talking about mind and brain function and introduced you to the importance of building cognitive reserve. In June, we learned about ways to know if your mind is experiencing the normal aging process or if you are moving toward dementia. For example, forgetting someone's name during a conversation but recalling it later is normal, but losing your place in a conversation and forgetting what to say next or repeating yourself often could be a sign of dementia. In July, we talked about lifestyle changes that can promote a healthy mind and reduce the risk of developing dementia. We talked about the importance of the right diet, the right type and amount of exercise, getting good sleep, socializing, and engaging in things that build cognitive reserve. Finally, in August, we learned about the exciting concept of cognitive reserve. Cognitive reserve is like putting a deposit of new pathways in your brain in order to protect it from damage or dementia. The more pathways we build, the more we can function if we lose some of them as we age. We learned that the key to building cognitive reserve is to engage in very challenging brain activities and new learning. ACTS Rehab has a program that assesses your risk factors for cognitive decline and for building your cognitive reserve. If you want to know more, talk to your director of rehab. Last month, we learned about pelvic health and ways to manage urinary incontinence. We learned that bladder problems are common in older men and women, but they should not be accepted as normal. Too many people are embarrassed to seek help and miss out on a lot because of fear of leaking or an accident. There is help available. There are many different types of incontinence, and they are treated differently. We discussed the importance of drinking enough water and that many don't drink enough out of fear of having an accident, which actually can make the problem worse. We talked about food and liquids that irritate the bladder and contribute to incontinence. If you want to learn more, please call your director of rehab to have a private conversation. In case you missed any of these great presentations and want to see them, talk to us. Many of them were recorded and have played on the in-house TV, and all of them have handouts that we'd be happy to get to you. Now we get to the final component of Thrive with ACTS, and that is energy. Many residents tell us that they just feel tired all the time. Many say that they are too tired to exercise or socialize. We are going to discuss some reasons for that and what you can do to increase your energy and vitality so you can enjoy the maximum benefit of being part of the ACTS family. According to the National Institute of Health, there are a number of causes of fatigue and exhaustion. The first is illnesses and diseases. Things like rheumatoid arthritis, cancer, diabetes, heart disease, lung disease, kidney disease, thyroid disease, liver disease, or infections. If you have one or more of these, stay with me. There is good news coming. There are medications that cause fatigue. The most common are antidepressants, antihistamines, and pain medications. Sleep disorders obviously cause fatigue. Ironically, many medications that cause fatigue also cause sleep disorders, so you get a double whammy. Again, stay with me. Good news is coming. The National Institute of Health also states that our emotions cause fatigue. It has certainly been a year of worry, anxiety, depression, and stress, hasn't it? Many of us have found ourselves in a quandary of isolation due to the coronavirus, worried and not getting enough physical activity and socialization. It's no wonder many of us are feeling excessive fatigue. But again, hang on for good news. Let's talk about frailty for a minute. When I say the word frail, perhaps a person you know comes to mind. You might picture that person as ill, in Willowbrook Court, unable to walk, or very thin. However, there are many frail people living an independent living who do not appear ill, walk by themselves, drive, and are essentially independent. They do not even know they might be considered frail. So what is frailty? Frailty is a true medical syndrome. It is a period of time where someone is vulnerable just before they become disabled. We call this the slippery slope of aging. When a person is frail, it might just take a fall, a short illness, or something minor to push them down the slope to where they end up in the hospital. There are 5 cardinal signs of frailty. Complaining of being tired or exhausting all the time is one of them. The good news is that the likelihood of frailty can be measured by attending your Thrive Screen events. You might not think you are frail. You might not feel like you are frail, but it is important to know. Get your Thrive testing annually so you know how you're doing. It is better to act now before you become frail so you don't end up there in the first place. You are probably thinking, what are the other signs of frailty? In addition to feeling exhausted, weakness is the second sign, which we've already talked about and can be measured in Thrive screens. Slowness is the third sign of frailty, and this too can be measured. The fourth is reduced physical activity, meaning less than 30 minutes of structured activity on 3 days a week. And finally, unintentional weight loss of more than 10 pounds in a year. Having any one of these signs can suggest that you are becoming frail or are frail. Preventing frailty prevents many other things that no one wants, like falls and dementia. This is why we encourage all ACTS residents to participate in their annual Thrive Screen so we can catch it early. Well, I've been talking about the good news regarding reasons for fatigue. The good news is there are things you can do to help reduce your fatigue and improve your energy levels. Those things are regular exercise, managing your pain, improve your sleep, work with your physician on reducing the amount of medications you take, reduce negative emotions like worry, depression, anxiety, and stress. Now there's even better news. What do you think helps older adults manage the effects of chronic health conditions like arthritis and heart disease, reduce pain, improve strength, reduce the need for medication, improve sleep, and reduce anxiety and depression? Any guesses? The answer is regular exercise. There are many benefits to energy exercise. It improves functional abilities, improves quality of life, protects against disability, improves sleep quality, reduces body fat, improves brain health, improves glucose tolerance in diabetics, and reduces the risk of developing type 2 diabetes. It improves muscle and bone strength. But my favorite is the last one. Regular energy exercises reduces your biological age by 10 years. How many times have we said, if only I was 10 years younger? Regular exercise can make your mind and body feel 10 years younger. What is energy exercise? Energy exercise refers to working your heart and lungs to an adequate level. Some may be more familiar with the term aerobic exercise. The heart and lungs are vital organs that supply nourishing blood to all the cells of the body. They're muscles and must be exercised, just like your leg muscles. The key is that the exercise must put a safe load on the heart and lungs. We often hear residents say they ride the new step every day for 30 minutes. And we wonder, do you get short of breath when using the new step? The resident smiles and says, oh no, I don't get short of breath at all. The truth is that you should get a little short of breath during exercise for energy if you really want to make a difference. So what is moderate intensity exercise? Well, it involves getting your heart rate up to a predetermined target based on your age, resting heart rate, and your specific health profile. It involves getting your breathing rate up to a target level. And it involves a specific amount of time for at least 150 minutes a week, which means 30 minutes on 5 days of the week or 60 minutes on 3 days of the week. And it requires working a little harder as you improve. So what is a rating of perceived exertion? We look at it on a scale of 6 through 20. If 6 means no shortness of breath, like you are just now, and 20 means gasping for air, you should be at least 11 out of 20 when doing energy exercise. In the scale here, a 10 to 11 says, I'm still comfortable, but I'm breathing a bit harder. A 12 says, I'm sweating a little, but I feel good, and I can carry on a conversation comfortably. And a 13 says, I'm just above comfortable. I'm sweating more, and I can still talk easily. When you are at an 11 to 13, you are engaging in moderate intensity energy exercise. Why is this a 6 to 20 scale instead of 1 to 10? Well, the reason is because the 6-20 scale correlates with the approximate heart rate by adding 0 to the number. For example, if you are sitting still, you would likely rate yourself as a 6 out of 20. If you add a 0, you get 60. Your heart rate is approximately 60 beats per minute. If you just ran up 3 flights of stairs and you rate yourself as a 20 out of 20, you add 0 to the 20 and your heart rate is likely around 200. Everyone is different, so this is just an approximation. Some conditions and medications interfere with your heart rate as you exercise, so it is important to learn from a therapist how to best measure your personal exercise intensity. As we said earlier, our mission is to listen to the health experts and help all ACTS residents engage in an exercise prescription for the 5 key areas of balance, flexibility, strength, mind, and energy. A prescription is very individualized, and just like a pill, exercise is medicine. You need to know exactly how to take your medicine, meaning what to take, how much, when to take it, and how to fit it into your busy life. Where to take more of it or less of it, how your medical conditions impact your prescription, and what to expect. It is important to attend your therapy sessions so we can establish a good progression until you can take over on your own. This is what Thrive with ACTS is all about. Regular exercise and the right exercise is probably the most impactful thing you can do to improve your energy. Physical therapists like to say that exercise fixes just about everything, but here are some additional tips. Keep a regular wake and sleep time schedule. Avoid those late afternoon naps. If you feel like you must, set an alarm and make yourself get up after 30 minutes. Naps longer than that can make you feel sluggish. Avoid exercising within 2 hours of bedtime. Exercise wakes you up and may interfere with getting sleep. Avoid caffeine in the evening. That cup of coffee with dessert at dinner might be affecting your sleep. Avoid alcohol in the evenings close to bedtime. While it might make you feel sleepy, alcohol interferes with the quality sleep. Limit junk food. Our bodies need good nutrition for energy. Get out and laugh with friends. Laughing and socializing increases feel-good chemicals in your brain. Try new things. Learning new things improves your brain health and stimulates your energy levels. Keep a fatigue diary. Note what you did and what you ate on days you feel especially tired to see if you can determine energy zapping culprits. Finally, make a commitment to take your energy medicine. Just like taking your pills becomes a habit for your health, so should your exercise. Handouts are available. One is a summary of today's presentation, and the other is a summary of all the rehab presentations from 2020. If you want to learn more about any of them, contact Yvonne. Thank you so much for listening to the presentation. My name is Amanda Sorrell, and I'm a physical therapist here at Tryon Estates. If you have any questions, let us know. We are here to help, and we want to keep you thriving with ACTS in 2021.